Welcome to Healthy Women 2000. I'm Dr. Susan Blumenthal. Today we'll be discussing post-traumatic stress disorder, a condition that has traditionally been associated with combat veterans, but is now known to be a serious health concern for millions of American women over their lifetimes. Before the formal diagnosis of PTSD was developed, men suffering from the symptoms of this disorder were considered shell-shocked from their experience on foreign battlefields. However, many women and children suffer from the trauma they receive from battles closer to home. Battles such as sexual assault, physical and mental abuse, and rape. In part, this may be why many women have difficulty seeking professional help for their symptoms. It is not only the women, however. Many physicians have not been trained or are not sensitive to this condition in women. This has led to women being misdiagnosed and inappropriately treated for post-traumatic stress disorder.
Some have sort of displaced their concerns onto their bodies. So they say, well, you know, my digestion isn't working well, or I'm feeling fatigued, or they have some other kind of problem that becomes the focus. And very often in medical and even in some psychiatric treatments, the importance of a traumatic event and its aftermath is not taken seriously.
Diagnosing PTSD can be difficult. This is because of the wide range of symptoms that can manifest as part of this illness, along with the reluctance of a person to discuss having experienced a traumatic event such as domestic violence or sexual assault. The disorder is often misdiagnosed, and as a result, women may receive inappropriate treatment for the condition. That is why it is very important to educate both the medical community and the general public about the symptoms and causes of this often debilitating disorder, and to conduct more research on effective treatments and preventive strategies. We're discovering that the severity of the trauma and the individual's reaction to it is more important than the type of trauma experienced in the development of PTSD. Examples of traumatic events may be a natural disaster like a violent storm, flood, or earthquake, being involved in a serious accident, or being physically assaulted or emotionally abused by another person. These traumatic events may have happened recently or may have occurred years prior to the development of the symptoms.
The key issue in a traumatic stressor isn't pain or fear or military action. It's the experience of helplessness. It's the fact that for a few moments or minutes or hours or days, you have no control over what happens to your body.
Symptoms of PTSD include 3 prominent characteristics and must be present for at least 1 month to make the diagnosis. The first is increased physiologic arousal, including increased heart rate and sweating, and difficulty falling or staying asleep. The second is psychologically re-experiencing the event. The third is persistent avoidance of the stimuli associated with the trauma and numbing of feelings and emotional responses. Increased physiologic arousal can manifest in the person being edgy, irritable, having sleep difficulties, problems concentrating, and always feeling on guard for possible threats. Re-experiencing involves recall of the traumatic event in one or more of the following ways: recurrent and intrusive recollections of the event, nightmares and flashbacks, which are terrifying experiences where the individual feels or even acts as if they are actually re-experiencing the event, which can occur often and without warning. The person may also experience intense psychological distress when exposed to internal or environmental stimuli that symbolize or resemble some aspect of the traumatic event. Additionally, avoidance of thoughts or places specifically associated with the traumatic event and numbing of feelings often occurs. This avoidance may even include amnesia for parts of the event. There also can be a loss of normal emotional response to everyday life experiences, a kind of emotional anesthesia. A woman may feel numb and that her emotions don't seem real, distancing her from friends and family and making it difficult to trust others or be in an intimate relationship. She may also experience markedly diminished interest or participation in usual activities, and she may have a sense of a foreshortened future.
Frequently, the trauma that's happened to them has happened in the context of a personal relationship. And they often feel that's something to be embarrassed about or something that they might have contributed to, and hence they need to keep it a secret.
Undiagnosed and untreated, symptoms of PTSD can last for years and have serious health consequences. They can also damage a woman's self-esteem and impair her ability to have relationships and function at work. However, effective treatments are available that can reduce or eliminate symptoms of PTSD.
If we could give every kid who we knew to be traumatized an immediate course of psychotherapy at the time that we found out that they were traumatized, we would have a lot less juvenile crime, we would have a lot less accidents, we would have a lot fewer adults who turn around and attack children, because the kinds of repetitious behavior that you get from these children in their older life a lot of times is to be a victim themselves, but sometimes is to become a perpetrator. And the more of these children that we leave untreated and unnoticed and untaken care of in our society, the more of these kids are going to turn around and get us later.
Severe, unexpected, or prolonged exposure to traumatic events, including injury, fear of death, or the loss of one's social support system, increased the risk for PTSD. Holocaust survivors, prisoners of war, and refugees are particularly vulnerable, as are women who are victims of crime, psychological abuse, or physical violence, including sexual assault.
Type 1 PTSD is an immediate, acute type of action, like a mugging, a rape, a car accident, something that happens immediate. The type 2, I have seen more in Holocaust survivors, especially here in Florida, some of the older people that have spent maybe 150, 200 more days in a concentration camp. The trauma continues.
Also, if the trauma is the result of an intentional act, such as physical or psychological abuse by a spouse or boyfriend, she may feel deep shame and guilt in addition to other strong reactions.
When you get into that kind of self-blame, loss of esteem, putting down yourself, and the other person is supporting that, it's very difficult to gather the strength and say, this isn't me, it's you. And to be able to say, I'm going to step outside of this situation. It's also very difficult for women to leave abusive situations like that when they are actually economically, socially, or in some cases physically dependent on the other person, and the other person is saying, if you leave me, I will destroy you. And in fact has the capability to do just that.
And I had a serious head-on collision, and I had a head injury, and my face was messed up. And after that, I went down the drain, and it completely changed my life.
Studies have shown that women with undiagnosed PTSD seek general medical care more often than the general population, with a 2 to 3 times higher rate of medical visits seeking treatment for physical ailments. Women with PTSD may complain of abdominal pain, chronic pelvic pain, muscle aches, joint pain, and headaches. While these symptoms may reflect the presence of an actual physical condition, if inconsistent findings are found on the medical exam, physicians should consider the diagnosis of PTSD when a history of trauma is present. This is especially important in primary care settings where a woman who has symptoms of PTSD may be seen first.
The vast majority of women suffering abusive violence don't come into mental health clinics. They come into emergency rooms in the United States. And if that's not detected, or if they're sent out without adequate assistance, more often than not, they go right back to that setting and are in the same danger of losing their lives.
Individuals with PTSD may suffer from other mental disorders as well, including major depression, phobias, alcohol and other substance abuse, and personality disorders. To some degree, women and men differ in their response to being traumatized. Men with PTSD tend to abuse alcohol and other drugs and may become violent themselves, while women suffer higher rates of clinical depression and anxiety disorders, such as panic attacks, in association with the PTSD. Eating disorders may also be a problem.
I wasn't eating. I wasn't doing a whole lot, and I really questioned, like, why me? Why is this going on? And I was feeling very useless and hopeless.
Recently, mental health professionals have found that domestic violence is a major risk factor for the development of PTSD in women. Women who are the victims of domestic violence seem especially at risk for PTSD because of the constant physical and psychological abuse induced intentionally by another person, often a loved one or a trusted family member.
I was asleep in my bed, and my ex-husband came over and beat me severely and raped me. And I was pretty much unconscious for most of that night. And the next day, when I was able to wake up, I called my manager at work and I said, gosh, I'm bleeding all over, and because I couldn't figure out what had happened to me.
In rape survivors, I see post-traumatic stress disorder as problems in processing what happened to them. In some ways, it's almost like it's obviously a horrible event that should never have happened to them, and it continues to haunt them. They're not able to go on to get away from it. When they sleep, they dream about it. They wake up scared. They go to sleep scared. It's hard for them to talk about it. They feel that many, many, many situations are dangerous, even ones that are relatively safe. And it never goes away for them.
Intervention should begin as soon as possible following a traumatic event to prevent symptoms of PTSD from developing. Treatment approaches include individual and group psychotherapy, medication, or their combination.
For the first time, they may be able to get together with a group of women who have suffered similar violence or similar trauma and find out that they're not alone, that they're not different, that there's not something personally shameful about what they did do or didn't do to bring about the event, and that there's a lot of learning that they can do from other women about how to handle some of the symptoms and also just how to go about living their daily life.
The American Psychiatric Association, with 40,000 physician members, is the nation's oldest medical specialty society. For more than 152 years, the APA has fought hard to ensure that people suffering from mental illnesses, such as PTSD, have full access to high-quality psychiatric care.
The American Psychiatric Association has signed a contract with the Red Cross to provide the psychiatric component of disaster involvement, and we have disaster committees in many areas of the country that are doing a wonderful job in helping the public deal with disasters, which in turn can help them deal with post-traumatic stress disorder. And the goal of the American Psychiatric Association is to assure access for America's citizens suffering from mental illness to high-quality, compassionate care. As part of our educational programs, we have pamphlets on post-traumatic stress disorder and other disorders. We have speakers bureaus, speakers who will go out and address the public on these critical issues, providing them with information. We have begun an initiative with the American Legion working on post-traumatic stress disorder, which, as you know, is of grave concern to the veteran community. We can't afford not to treat the mentally ill, forgetting the humane issues. If we do not treat the mentally ill, their conditions worsen, there's enormous suffering. If we really truly believe in family values in America, we would not expose families to the suffering of having an untreated mentally ill relative within their ranks. We need to fund the care of the mentally ill as we do any other illness. The nation will be better off, the people will be better off, our workforce will be better off. It will be a win-win situation for everyone.
Over the last 5 years, major strides have been made in treating PTSD more effectively. This includes the use of behavioral therapies and some medications. During the 1980s, insight-oriented psychodynamic psychotherapy was used in treatment. This form of psychotherapy focuses on identifying the unconscious causes of a patient's conflicts. It's now generally accepted that a different form of treatment may be a better choice for victims of PTSD. It's called cognitive behavioral therapy.
I find what's very helpful with patients is to not just picture what happened, but also picture what did you do to protect yourself or to protect someone else. In other words, face the reality of what happened, but also see it from a new point of view. So this kind of cognitive restructuring of the traumatic memory can be very helpful.
The goal of treatment is to reprocess the trauma by focusing on it, helping the individual understand and reintegrate their experience and its triggers. With therapy, a woman may no longer consider the traumatic event as the focus of her life, and treatment also helps to diminish the constant feelings of threat that she may experience.
My therapy is like the middleman between the trauma and myself, because I didn't know how to adjust to it, and therapy's helped me understand it, I guess cope with it, see it as for what it is, and I gave a lot of power, I guess, to the trauma, and thought that it was going to control me, and I've started to realize that I don't have to let it control me.
In conjunction with psychotherapy, Specific medications may also be used to help control severe symptoms like anxiety and depression and improve the woman's ability to function at work, to have relationships, and to benefit from psychotherapy. Most useful have been particular antidepressant medications which improve sleep, decrease anxiety and anger, and help suppress intrusive and disturbing thoughts. There is growing evidence that serotonin, a key chemical messenger in the brain, is important in PTSD. Avoidance behavior, impulse discontrol, and sleep disturbances found in PTSD are associated with serotonin regulation. Therefore, selective serotonin reuptake inhibitor drugs may be effective in strengthening impulse control, regulating mood, and improving sleep.
What medication does, particularly antidepressants, although also drugs that treat anxiety, it's helped put a damper on some of the most problematic symptoms in post-traumatic stress. And those are usually things like nightmares, sleeplessness, extreme depression, panic, very great irritability. And what it does is it allows the person a little more comfort physically in the day and also during the night, and also often allows them to take part better in therapy because they're able to be more active and participatory and not so sort of disabled by their symptoms.
While continued attention must be paid to identifying those women with PTSD and providing them with effective treatment, vigilant efforts must be undertaken to prevent the development of this disorder. There are currently several public health approaches being undertaken. These include local, state, and federal legislation, tougher penalties for offenders, more research, training for healthcare professionals and police officers, and the development of effective intervention and prevention programs in communities across the country for victims of violence. Given the epidemic proportion of childhood abuse, domestic violence, and sexual assault affecting our nation's girls and women today, it is likely that PTSD will continue to be a significant problem that affects women's mental and physical health. We must all work together to eliminate these public health problems as threats to the lives of American women. That concludes this edition of Healthy Women 2000. We'd like to thank all those who helped make this program possible.